Is this gonna hurt? Hi guys, welcome back to the Momma Nurse channel. I'm Vanessa and today we're going to discuss my experience with IUD placement. Don't forget to like, comment, and subscribe. If you're new to my channel, welcome. For those of you who are coming back, thank you for your support. So about midway through your pregnancy, your doctor is going to start discussing birth control options with you. I've done the pill in the past. That's pretty much the only birth control that I've ever done. But now being a mom of 4 and a full-time nurse, I didn't feel confident in myself to remember to take the pill all the time. Even though I used to set alarms, sometimes your schedule can be chaotic, and working night shift, my sleep times are different every day. So I needed something else that was a little bit more suitable for my lifestyle now. So I opted for the IUD. This was my first time having it done. So at that visit, while I was still pregnant, I went ahead and filled out the paperwork. They send it off to the manufacturer as well as get insurance approval. So once they do all of that, they send the Mirena, in my case it was the Mirena that I used, they send the Mirena IUD directly to your physician. So they did notify me of when it got delivered, and that was before I even gave birth. So there are numerous birth control options out there. You could have the IUD, the pill, the patch, the injection. There are multiple different types. So if the IUD isn't something for you, please don't feel like you're not able to protect yourself against pregnancy if that's your wish. There are other choices, so just explore those options with your doctor. So at my 3-week and my 6-week postpartum visit, we did do like a confirmation to make sure that I still wanted the IUD, which I did. It was recommended that since I am breastfeeding, that I get it placed at 8 weeks. The reason being, while you're breastfeeding, your cervix is still a little bit softer than the average cervix of somebody who is not breastfeeding, and you want to decrease the chances of rupture, which would be the IUD penetrating your uterus. So it's recommended that it's placed at 8 weeks, and that decreases the chances of rupture significantly. So I went with their recommendation and we had it placed at 8 weeks. So once you get to your doctor's office, it's similar to your previous visits. You're going to give them a urine sample. They're going to check your weight, your blood pressure, and your heart rate. So for that urine sample that you give, they will be checking for a negative pregnancy test, and then they also will be checking for chlamydia and gonorrhea. They do check for those because it is contraindicated with IUD placement. So you will get those 3 tests completed that day in the office. So once you go into the examination room, the supplies or the instruments are already laid out. They are, of course, still in their sterile packaging. So I'm going to go ahead and insert a video here that shows you each instrument that they have just in case they need it, and I'll go over what each of them are for. So here we have all of our supplies. We have 2 iodine swabs, lubricating jelly. We have a speculum, same one that's used for your pap smears, a light source, and a panty liner. So this is the actual Mirena. It is the top portion. The rest of it will be cut off. It does have measurements so they know how far to go in, and this bottom portion will be cut off and removed after insertion. This is used to hold the iodine to clean the cervix and uterus prior to insertion. This is used to measure the uterus, and it aligns with the measurements on the IUD. This white piece is used to open the cervix if needed. And these are used to cut the strings. There was one more device that I did not get on video, and it's to hold the uterus in place so it's straight, and that's only used if needed. So even as a nurse myself, walking into that room and seeing all of the instruments laid out, kind of made my heart stop a little bit. It's different being on the other side. I wasn't the one using the instruments, so it was a little nerve-wracking. The nurse that was in there with me, she did go over what each of them were for and let me know if they'll use it or not. So once we did that, I did have 2 consent forms to sign. One was for the manufacturer, which would be the Mirena company, and then the second one was for my doctor's office. So just make sure you read over those consents, and if you agree with everything, then you can go ahead and sign them. Once the procedure began, it took honestly no more than 5 minutes. I didn't time it, but we kind of talked through it and things like that, and it was probably about 5 minutes or so. They did say that you would feel some cramping. Personally, I didn't. I knew something was going on, but I didn't feel cramping exactly. Super easy. There was little to no pain. After my doctor's visit, I did have some errands to run. So maybe 20 minutes post insertion, that's when I started feeling the cramping, which was normal. They said that you might feel cramping for up to a week after placement, and you might also have some bleeding as well. So they do give you a panty liner to wear home from the doctor's visit. And like I said, about 20 minutes after it was placed, I had a little bit of cramping, and that cramping lasted probably 30 to 45 minutes. And I've always had really bad menstrual cramps. So to me, it was probably a mild menstrual cramp type of pain. So just a couple tips and reminders for an IUD. The Mirena itself is good for 5 years. You will need to check your string once a month every month until it is removed. The first month will be checked at your doctor's office. You will have to do a follow-up visit at that 1 month mark. At that appointment, they'll check your string to make sure that it's not too long, and they'll also check placement to make sure that it hasn't moved within that time. So starting from 2 months and on, you will check your string once a month every month to make sure that it has not moved. So they do give you this card. I'm gonna block out my doctor's information, but it just has your name, the date that it was inserted, and the date that it is due to be removed. And then here you can put down each one of your next appointments so that you can be reminded. So you need to keep that in your purse or your wallet. And that's just the company itself, the Mirena follow-up reminder card. So good for 5 years. Check your strings once a month, every month. The strings at first are firm. They will soften up over time. Once they did insert it, the string that they cut off, they went ahead and let me feel it, so I kind of knew what I would be looking for. They did say that it is pretty noticeable when you're going to check for it, but they have not had any complaints or things like that from men. They say that men typically don't feel it when you are having intercourse. So we will see about that. It is easier for placement for mothers or women who have had children only because your cervix has been open already. So I'm a mother of 4, so it was a pretty painless experience for me. So the nurse practitioner who placed my IUD is not a mother, and she has an IUD, and she said it was pretty painful when she had hers done. The nurse who was in the room is also a mother, and she as well has the IUD, and she did not think that it was painful either. So it is a little bit easier for moms, so just keep that in mind. Once you've gone through childbirth, an IUD is an easier placement for you. No sex for 1 to 2 weeks after placement. You don't want to move the IUD in any type of way because then it won't be effective. And the effectiveness starts about 2 weeks post-placement. So during that time, you could still get pregnant if you are having unprotected sex. So 1 to 2 weeks after placement, no sex. So overall, I'm about 4 days post-insertion, and I haven't had any complications. I don't have any weird side effects going on or anything like that. So we will keep our fingers crossed that this is a good option for me. It does last for 5 years, but if something were to occur or we change our mind and want to have more children, it can be removed at an earlier time, but the lifespan of it is just 5 years. So that's about it that I have for you guys on my IUD experience. Don't forget to like, comment, and subscribe to my channel. Hit that notification bell so you can be notified every time I drop a new video. And if you have any questions about birth control, motherhood, nursing, anything like that, go ahead and drop it down below and I'll make sure to answer those questions for you. Until next time, be safe, be well, and live life.